I feel like a new man, I really do.
Every change has a reason, baby.
We're here with Mr. Edmundo Tovar, who recently had surgery on his lumbar spine. He underwent a lumbar spinal fusion at L5S1, and that was about 13 days ago. Is that correct?
Yes, sir. It was until November the 16th.
Tell us what your pain was like to begin with. What kind of symptoms did you have?
Before I came to Dr. Smith, I had pain through my whole body. My neck was killing me. My head was killing me. My lower back, my right side buttocks, my left foot was beginning to go outward, and it was getting to the point where I couldn't walk no more, and I was in pain all the time.
Did you take pain medication, or what type of stuff did you try to get rid of your symptoms?
They, since I come under the VA, they sent me to pain management for shots to cure the pain, and everywhere they sent me, nothing worked.
Have you had surgery on your back in the past?
Yes,
And when was that?
a little over 3 years ago.
And how did that go?
Ever since then, I was in pain.
Now, you just had surgery, which was, 13 days ago. It was on November 16th, 2018, 13 days ago. How do you feel today, 13 days after the
Sir,
surgery?
today I feel pain-free.
Okay.
I have no pain whatsoever. I'm a little walking, trying to walk. I use my walker. But I have no pain whatsoever. And I can thank Dr. Dean Smith that he's one wonderful surgeon and that God bless him all the rest of his life. But I am pain-free, beginning to walk real slow. I do walk with my walker. I am not taking nothing for pain medication right now. Actually, I'm not taking no medication.
Excellent. Sounds good. So what about the surgery itself? Was like the day you woke up, the day after that, was it more painful than you expected, less painful?
It was less painful because I remember going into surgery. I was so relaxed from that surgery that I slept the rest of that day and all night.
Oh, wow. And then how long did you stay in the hospital?
Day and a half. I was operated on Friday, and I went home Saturday afternoon.
And so you had previously had a fusion where they operated on L3, L4, and L5, and then we removed the metal out of the old levels, refused those levels, and then fused the level below that. So you had that's a really pretty extensive surgical procedure. Almost immediately you felt better?
Yes, I can say that when I woke up from surgery, again, I was pain-free.
And then what about the strength in your legs? How's that doing?
Right now, I'm having some little therapy at coming to the house,
Okay.
and they are working on my legs, but I can feel the strength coming back.
Now, anytime somebody's thinking about having surgery on the spine, that's a very scary situation.
Yes, it is.
Any advice you could give to people that are facing that might be looking at the need to have surgery at some point in the future?
Well, sir, I am 81 years old. I'm a career veteran, and so therefore I do talk to a lot of veterans. And when we start talking about back surgery, for some reason everybody's scared of a back surgery. They think that they won't be able to walk again. They rather fight the pain, rather take the medication. Or I can give you advice to anybody. Come and see Dr. Smith, and he will take care of you. Because
Very good advice. I like that advice. But yeah, anytime somebody's facing surgery on the spine, that's a very scary situation. Obviously, surgery should always be the last option. But if surgery is needed, in most cases, people do very well with it. So it's something you should avoid if you can. Try all the conservative techniques.
Well, again, my advice to anybody, don't fight the pain. Take care of it, get surgery, and if it works like it did for me, you're 100% I feel like a new man, I really do.
Excellent. I'm glad you do.
Now I get to sleep all night with no pain.
Well, I thank you very much for your time and keep up the good work.
Sir, I thank you again, and that God bless you, doctor.
God bless you as well.
Well, you know, I went through over 3 years, doctor, with that pain, and even though I'm pain-free right now, I'm still a little weak.
Yes.
Yeah.
It's too early.
Yeah.
I've lost, since that last operation, I used to weigh about 220.
Wow.
I'm down to about 180. My eating habits just, I start and I leave half of it behind because I just don't.
A lot of pain and stuff, you just lose your
Oh,
appetite.
yeah.
I think
But you know what, most of all, I have to give this woman a lot of credit. For over 3 years, she took my nagging and my, you know.
So you put up with this pain for 3 years?
Yes.
Is it nice to have him back to normal?
Oh, yeah. Oh, I'm glad for him. You know, he suffered a lot. And I suffered with behind him to saw him, you know.
Excellent.
But no, I'm so glad. I'm so glad.
I feel like a new man, I really do.